All right, so we've released another session of the Peptide Compounding Mastery course. And strangely enough, after I launched this, and if you're interested, we can put the link down below. We're having the course in September. But interesting enough, I got a lot of questions from people who got our launch email. And the question of pre-filled syringes has come up over and over again this last week. And so if you're not familiar with sterile compounding, or you're just kind of getting into it, normally when you make a compound, especially if it's an injectable, you dispense it in a vial, a closed sealed container. You know it's sterile, you know it's going to stay sterile as long as it's stored in the right conditions. But a lot of med spas and a lot of doctors' offices, especially with this GLP-1 craze, are giving patients pre-filled syringes. Now, it's certainly very convenient to give pre-filled syringes. There's no argument there. It's much easier than having the patient feel uncomfortable drawing up a dose from a vial. They're not sure they'll get the right dose and then injecting it into themselves. And so there's certainly a case of why people like pre-filled syringes. However, pre-filled syringes should not be used for dispensing as a container. And this comes, the differences between pharmacy and the medical side, we're really all held to the same standards. I mean, let's be honest, like USP is USP, but medical boards and the medical sides of things just look at it differently when a doctor's office does it as opposed to a pharmacy. So if you are a pharmacy and you do sterile compounding and you're listening to this video, please never, ever, ever dispense to a patient a pre-filled syringe that has a bunch of doses and they're going to, use one a week or whatever, because that is just not good pharmacy practice. And why is it not good pharmacy practice? Because syringes are not a container. You're using it as a container, but it really is an administration device. You have not done studies on that interaction of whatever is in the syringe, whether it's a vitamin like B12 or it's a GLP-1 peptide, of that rubber, the plastic, of what happens if we all know that plastic leaches APIs. And so you have not done the studies on that to prove that the product is still good 1, 2, 3, 4, 10 weeks later. And so really that's the big reason, is that the studies have not been done with your particular compound, with your exact ingredients and that exact syringe to know that the stability is still there. Taking the stability aside, it also comes down to sterility. Sterile syringes, although they are sterile, once you open that tip, even to withdraw into a vial, put the tip on, it is not a closed sealed system. A vial, you can shake it, you can do all kinds of things short of breaking it, and it is going to stay a closed sealed system. That necessarily isn't true with a syringe. Maybe the plunger gets pushed down, gets pulled back up. It is open to the air. And so they should not be used as dispensing containers. They should just be used as administration devices. And I know a lot of pharmacies, as you get more and more into the sterile compounding, you might be running up against some of these doctors' offices or some of these med spas that are doing that. And I think it's a really good education point that you can go to them and say, hey, I know we're friendly competitors, but I noticed you doing this and it may not be a good reason. Because let me tell you, if something happens and somebody gets cellulitis from injecting one of their syringes, you can bet that everybody's going to throw them under the bus because they dispensed them in pre-filled syringes rather in a closed container system. And so it really is opening them up to liability. And even if they don't change, even if they don't start using your pharmacy, you kind of still put some goodwill out there and let them know that, hey, we might be trying to sell the same things, but I'm just trying to help you. I want to prevent you from, something going really wrong. Because we all know in pharmacy, when things go wrong, they don't go just a tiny little bit, they go really wrong, so we just want to prevent that. We don't want bad things happening no matter what, because then that comes down harder on all of us. And we all know the medical boards aren't going to do it. It's going to be the pharmacies that take the brunt of any new regulation and rules that come down. So I think it's kind of being a good neighbor, and maybe you'll get their business. Maybe they'll say, hey, yeah, you know what? I can see that. I can see how we might be liable. I can see how maybe this isn't right. And what options do you have, that is comparable and will also keep the patient safe? So if you run up against that, that is probably my best tactic for you to try to overcome that is one, they're not real containers. They're administration devices, and it's not a closed sterile container system. So you're possibly putting the patient at more risk than certainly a sterile vial for something going wrong on the sterility side, and it hasn't been tested for stability in that closure sterile syringe. Even though it's sterile, the stability of the product and making sure that plastic doesn't absorb all the ingredients, so then your patient is just injecting nothing. So those are some talking points for you. If you have any questions, feel free to reach out, post in the comments below. Happy to help you. If you enjoyed this and it was helpful to you at all I ask is that you please share the show with another pharmacy owner. It might be helpful to them, and it'll help me know what content you like, and I can make more of it. So thank you so much, and I can't wait to hear all the great things that I know you guys are doing, especially in the weight loss world.